Good evening, everyone, and thank you for joining us tonight for the ninth and final of our 2021 legislative session virtual town hall series. I'm Heather Bagnall, your delegate in District 33. I first wanted to thank you all once again for your continued commitment to staying safe by practicing physical distancing, safe protocols as we work to get every adult fully vaccinated. I also want to take a point of personal privilege and ask that you follow the CDC guidelines, not as they have been interpreted, but as they were intended. Though we are seeing a relaxing of restrictions, COVID is very real and still very present, and it requires everyone to ensure we can keep our communities safe and solvent and moving towards some semblance of community beyond this virtual world. It's hard to believe we are a little more than 2 weeks post-sine die on one of the most significant, impactful, and unusual sessions in our history. I also want to thank you all for being here tonight. I did not anticipate that I would be the opener for the president, so the pressure is really on. With the multiple crises created by COVID, we were tasked not only with the usual operations of a legislative session, but with ensuring the safety and solvency of our Maryland communities while also addressing long-standing systemic issues in our institutions, which were brought into stark contrast during the pandemic. I often say that government is slow to respond by design. Laws should not be written or unwritten quickly, lest they be weaponized. I also frequently tease that Maryland loves to be a leader so long as someone else proves that it works first. This session, I am proud to report that I had to eat those words repeatedly because I truly believe that we as a body rose to this moment in our history with a historic session. Tonight, I'll talk about our legislative successes, our failures, and where I forecast we go next. If you haven't done so yet, please be sure to subscribe to my social media. I primarily use Facebook and Twitter for immediate information, and so as not to clog up your inboxes, but I am sending my end of session letter, which goes into a good bit of detail on the legislation. I will warn you, I've been accused of many things in my life, but brevity is not one of them. There are a number of elected officials and community leaders represented on this call tonight. I want to thank you all for being here and for your help, your advocacy throughout the session and throughout the year. I especially want to thank our congressional partners who have been working side by side with us throughout the pandemic. Thank you once again to Adam Spangler from Congressman Brown's office, Jalen Money from Senator Van Hollen's office for being on this call, and Ben Smith, who is here on behalf of the comptroller. I'm going to work to keep this call to an hour to respect your time and because I know we are all a little zoomed out. So I'll attempt to answer as many questions as I can, but if we can't get to your question on the call, we will circle back with you to make sure you have answers. If you have a question and have not submitted it in advance, please feel free to put your question in the chat. I also want to thank Max Pierce, my chief of staff, and Luke Tudball, who consistently work behind the scenes to make me look very tech savvy and also always on top of every issue. Following tonight's town hall, feel free to email my office and we will get back to you as quickly as possible. And I will tell you from here on out, I am going off script and we are just having a conversation. So I want to jump right in with this legislative session. For anyone who is following, we not only had a live stream and we had a combination of in-person and virtual hearings and voting sessions and floor sessions. We also didn't have the same from the House to the Senate. And of course, we have new leadership in both chambers with President Ferguson and Speaker Jones, both of whom had their first their first legislative session last year when we were in the midst of, as we started into the pandemic. And I really do feel like they met this moment in a really profound way. For those who don't know, our information office spent the entire interim rewiring our entire compound so that we could be socially distanced. The House of Delegates for our floor sessions was actually in two different spaces. We were in the main chamber and we were in what was affectionately called the annex. That is where I was. So we were in real time communicating across the chambers. And I have to I have to really give credit to our leadership in working with our local health officer and our state health department. I would be remiss if I didn't mention the good work of Dr. Kalyana Raman, who is the health officer for Anne Arundel County, who also became the primary contact for the House of Delegates. We also had our leadership also set up an on-site testing center so that we could make sure that we were not only protecting each other in the legislative session, but also protecting the community. I conveyed early on my concerns about the numbers in Anne Arundel County because we had worked so hard as a county to make sure that we got ahead of COVID, and I wanted to make sure that we didn't see a spike during the General Assembly. And I will say that our leadership really rose to that task and made sure that we were safe, that we were protected, that we were adhering to the protocols, and also that we were modeling good behavior. I think that's really important as an elected representative that we are modeling best practices, and I think that as a body, our leadership really took us to task on that and made sure that we were modeling the good behavior and the best practices to keep everyone safe, and that was really important. So what happened this session? I'll start with the budget. So of course, going into the General Assembly session, there were a lot of concerns about lost revenue, about where we were going to be following this extended shutdown. And again, I have to applaud our federal partners who really worked hard to make sure that we were getting federal funding to stabilize our budget. And I have to applaud you as well, because we didn't experience the revenue losses that we had anticipated. We actually were in better shape going into the budget process than we anticipated. So what did we do with this budget? Well, we had a historic budget. We were able to eliminate the structural deficit. We were able to restore the rainy day funding that had been depleted, in response to the pandemic. And ended with a strong cash balance in anticipation of any future emergencies, because as we know, we're still in the midst of COVID. We're seeing what's happening in other parts of the world, and we want to make sure that we are in a place not only health-wise, but also financially to address and anticipate any future emergencies. We were able to fully fund our healthcare and our education. The blueprint, which was the big legislative effort last year, our education package, which will give us a globally competitive 21st century education system, and record school construction is fully funded through 2026. And we also now have a $1.5 billion budget for construction projects, which also puts Marylanders back to work. So we were really proud of the work that came out of appropriations. It was quite historic. Of course, we also have the capital budget, and we were able to leverage $2 billion in state capital spending. We prioritized education, recreation, support of localities. We were able to do $25 million in state funding for capital and improvement projects around just within Anne Arundel County. I was very honored once again to be the co-chair of the Capital Budget Subcommittee. I was chair of the capital budget subcommittee last year. This year, Delegate Shanika Henson from District 30A took on the responsibility of joining me as co-chair. She also was the chair of a new committee, which was the brainchild of Delegate Sandy Bartlett, our chair of the delegation, which was a subcommittee on public health. And so it's really exciting to see what we're going to do in Anne Arundel County as a delegation as that develops. And that was inspired by the mold issues that were occurring in some of our Annapolis public housing. But as we know, health and education are two of the biggest contributing factors to people's ability to thrive. And so we're going to be doing work going forward on public health in Anne Arundel County. I was the sponsor of a number of bond projects in Anne Arundel County and District 33. I was honored to be able to bring funding for Langton Green once again. For those of you who are familiar with this, or who are not familiar with this particular facility, they are one of our nonprofits in District 33 in Crownsville that provide services for adult members who have intellectual disabilities, and they were really challenged during the pandemic, and really again met that challenge in a very profound way. Last year, we were able to fund the restoration of a building that had a compromised roof. They were using it mostly for storage, but it was really meant to be their office space. So they were able to break ground during, all throughout the pandemic. They were able to rebuild the building, and we were able to bring them additional funding this year so that they could start work on the second building that is being restored. We also were able to restore the funding for Cape St. Clair for the shoreline restoration project. For those who were following that saga, of course, Cape St. Clair started a shoreline restoration project about 10 years ago. They actually started the permitting process about 7 years ago, and through a number of hurdles and challenges, including an attempt to build a pier through the middle of the beach property. They continued to fundraise and work on the permits, and I helped on the back end when they had a hiccup with the Department of the Environment to make sure that the process could continue forward. But last year, after we had gotten them funding through the Waterways Improvement Fund, that funding was reconsidered, and it threw the entire project into jeopardy. This 7-year, $1.5 million project into jeopardy. And so we were able to work with. I was able to work with my Senate partner and with the entire delegation, and we were able to restore that funding. So that's sort of the quick snapshot of the budget. Obviously I'm trying to just hit the highlights tonight. So I apologize if there's something of more detail that you would like. Please feel free to let me know. I do want to talk a little bit about my legislation, because I know that a lot of times we know about the big bills that are happening in the General Assembly, and sometimes some of what we're doing that's a little more sort of closer to the ground gets lost in the conversation. But I had a bill this year that actually I've worked on for a couple of years. It came directly from our district. It came from a group of adolescents who organized after a very high-profile suicide at their school to lobby for greater access for mental health services, to destigmatize mental illness, and also to lobby for suicide prevention. And it was a group called Our Minds Matter in Severna Park. And they asked to meet with their representatives, and I took the meeting. And in trying to strategize on how to address greater access, I went back and I looked at the licensure for behavioral health providers. And this is going to get a little bit in the weeds, so stay with me. But behavioral health is basically a large umbrella. And under behavioral health, you have substance use disorder, you have mental illness or mental health. But the umbrella is behavioral health. So we have a licensure for behavioral health providers, which is a combination of different providers. It's social workers, psychologists, psychiatrists, anyone who sort of is licensed under that field. A lot of social workers also, pediatricians, pediatric psychologists, and there are two under these two streams of behavioral health. There is no floor age for services for substance use disorder. That was in response to the opioid crisis. We wanted to, remove any barriers to care. But looking at the licensure consent for mental health services, it was 16. Now, we are only one of 4 states that had this huge disparity between substance use disorder and mental health. There are a number of states that address it differently. And so I spent about 6 months researching what other states had done. And I worked with stakeholders on it. And I worked with Senator Malcolm Augustine, who also has a background and a passion for behavioral health and greater access. And initially we tried to align to completely align the two statutes, but out of some concerns that were raised in the hearings, we compromised at 12. We also amended the bill to clarify it did not include prescribing. It did not change the consent for medication. It did not require services to be provided. It did not require that services be reimbursed unless there was parental consent, to try and incentivize parents to be involved. What it really did is it gave providers flexibility so that a phone call home didn't have to be the first thing that happened, that they could help and they could determine when that consent, seeking that consent, and how seeking that consent was in the best interest of the minor, or if there was a reason that seeking consent would be detrimental to the minor. It was a really, really important bill. We moved it through the Senate last year, and then, of course, we had a truncated session, so it stalled, and we adjourned. This year, we moved it in the Senate, and it stalled again in the House. It moved through the Senate. We had the votes, and I think again there was. Whenever you're dealing with a consent bill, it's always challenging. It's always a little scary for everyone. But this was a really common sense bill that we knew would save lives, and was really, really important. And in the midst of another debate, which was on the Juvenile Restoration Act, and I'll get to that later, but just quickly, it's exploring whether or not it is appropriate for juveniles who are sentenced as adults to have sentences that are life without the possibility of parole. That is no longer allowed in the state of Maryland. However, there are still pockets of adolescents who are in the criminal justice system who were sentenced to life without parole prior to this change in the law. So the Juvenile Restoration Act was really an attempt to give them the possibility of requesting a redetermination for their sentencing. It's always challenging whenever you're dealing with something like that, because you want to be as careful and as thoughtful as you can to the victims, but also recognizing that we have to question whether our criminal justice system is about housing people or whether it's really about rehabilitation. And I think the trend has been in criminal justice that we are looking at rehabilitation and diversion. And so we have to recognize the reality of that challenge and sort of make good on what has happened in the past. Maryland is also has the unfortunate reality of being the number one state in the nation for incarcerating Black men ages 18 to 26. And we have to recognize, we have to question why that is. But in the midst of this very charged debate around the Juvenile Restoration Act, when we were questioning whether or not adolescents should be tried, convicted, and sentenced as adults, the narrative that kept coming back was, well, why aren't we providing services before they offend? Why aren't we providing services before we offend? And I said, I have that bill. And I actually called upon the speaker and begged that we move that bill, because it did what everyone was asking it to do. And after a very, very challenging debate on that bill, both the Senate and the House bill passed the House. Now, the House bill, my bill, the Mental Health Access Initiative, HB 132, did not make it back out of the Senate. The Senate committee was actually very gracious in even giving it a hearing and trying to move it to the floor. But in the waning hours of sine die, I said, don't burn through all of your goodwill. You've already had this debate and we already have the policy. So this bill, the Mental Health Access Initiative, will be policy, and it will be the policy I'm the most proud of that my name will never be on. And so that was probably the most meaningful bill that I passed this year, and it's one that you may never hear about. And if it does what we hope it does, you'll never hear about it. But it will save lives. And so I was really proud of that. And another bill that was really important that we're still waiting to find out if the governor's going to veto. I'm hoping that he doesn't veto any of them. But a lot of you heard about what happened with unemployment, that we had, we went to this new vendor, Beacon, and in the midst of the crush of numbers during COVID, we really fell behind on unemployment. Well, there was another vendor change that sort of went under the radar. But it was, we changed to this vendor called Optum, which was for reimbursements for behavioral health services, working with Medicare, Medicaid. And we transitioned to Optum in January of 2020. And by April of 2020, we knew there was a problem. And the health department started doing pre-authorizations of reimbursements. By August, those pre-authorizations expired. And by September, some of these providers had not been reimbursed since January. So I put in an emergency bill that basically gives the Maryland Insurance Administration the authority to seek these reimbursements and make these providers whole, because without this money, and we're talking millions of dollars of outstanding reimbursements, without this, not only does it cause a major crisis in our behavioral health system, which is already underfunded and under-enrolled, but it could drive providers out of the market, which is absolutely what we don't want. We don't want behavioral health providers to only accept private insurance, so that we can't provide services to our most needful, most vulnerable communities who are utilizing Medicare, Medicaid. So again, I did that bill with my good friend, Senator Augustine. And we got both versions out the door. So we're just waiting on the governor's signature. And I don't foresee that. That being a problem. I had some other kind of cool bills. I don't want to spend too much time on them because I know we've got big legislation to talk about, but I did a bill that will expand the number of certified midwives in Maryland. Midwives are a really important part of our coordination of care. And right now we have a licensure for midwives, but not for nurse midwives, but not for certified midwives. What's the difference? The training is the same. The graduate work is the same. The venues are the same. The only difference is the undergrad program. And what this does is not only does it give us more midwives in Maryland, it also frees up some of those slots for nurses who want to pursue nursing as their profession, and not that they want to get that nursing undergrad so that they can go into the certified midwives graduate training. So it's actually part of a national movement. The board of nurses supports it. The Association of Nurses supports it. The physicians support it, which almost never happens where we get everybody on board. So it was actually really, really exciting to champion that particular bill. I want to turn to some of the big legislation that we did this year, because I want to make sure that we give time. We had, of course, pandemic relief, which was the lion's share of our early work in the session. We had the Relief Act, which a lot of you may know about. It did a lot of things. It raised the earned income tax credit for individuals with no children from $100 to $530. It made unemployment insurance exempt from state income tax. It helped 100,000 small businesses and nonprofits by deferring their unemployment insurance taxes for the first 3 months of 2022. It forgave some of those COVID loans and those grants. It helped minority and small business loans, converting $500,000 in equity participation program loans to grants so that they weren't having to pay them back. But that earned income tax credit was a really, really big deal, because we have found that is one of the most effective way. The earned income tax credit and the child tax credit are one of the most effective ways of bringing people out of poverty. So on the other side of the Relief Act, we had a second bill. We originally tried to do it as one comprehensive bill. We weren't able to do it, but we passed SB 218, which was the income tax, child tax credit, and expansion of earned income credit. Now, this was somewhat controversial because it was for ITIN holders. So anyone who had the individual taxpayer identification number. What that means is we were trying to give COVID relief to Maryland taxpayers, to every Maryland taxpayer, without regard to their status. It's not something that the federal government was able to do, which is why we had to do it at the state level, because we were the only relief for these communities. And when you're in the middle of a crisis, you don't tell people no. These are Maryland taxpayers. These are our neighbors, our friends, our family. And so that was a huge effort because it was considered controversial. And it was an effort not just by both chambers, but it was an effort that was supported by the Latino caucus and the Black caucus, where we all came together to make sure that happened and that we didn't leave anybody out, that we didn't leave anybody without relief. And it was one of those bills that I was really proud to vote for, even though in District 33, it might be considered controversial, because I was one of the votes that gave us a veto-proof majority. And I mention that because it was a moment where we really see elections matter, because we were able to help 30,000 of our Maryland residents, our Maryland taxpayers, because of an election in 2018. So I'm actually really proud of that. A couple other things that we did for pandemic relief was the Maryland Essential Workers Act and the emergency procurement. The emergency procurement bill was really important because it gives us more oversight and authority in future emergencies. Obviously, we have not had an experience anything like COVID-19. We have not had a health emergency the like of which in a century. But we have to know that there are lessons learned. And one of those lessons is that we need greater oversight so that we know where these dollars are going, but so that they can still be distributed quickly. Because we got the distributed quickly right, but we were weak on the oversight. And that's okay. You know, it's the reality of a crisis. But now we've learned from that crisis. And so we passed a bill to make sure that we have greater oversight and that we know where those dollars are going, so that we are not moving federal dollars through our state budget and not seeing where they're headed. And also making sure that we are adequately vetting the vendors with whom we are working. I'm going to turn to unemployment quickly. So within my own office, we had over 500 constituents that we were working with to help them navigate the unemployment system and fix issues with their accounts. Early on in the pandemic, obviously, it was just the crush of 30% unemployment in the state of Maryland, and quite honestly, years of reducing that agency that really hit us hard. But there were glaring issues in terms of oversight. There were major issues in terms of how we were outsourcing, not just the vendor, but also the call center. So my colleague in Anne Arundel County in District 31, Delegate Ned Carey, who is also the chair of the unemployment subcommittee, put in a reform package of bills. And they do a number of things. They modernize the UI system to ensure Marylanders can get their money, to get the money to which they're entitled. They improve customer service, which was probably the number one complaint that we got, was that people couldn't get a hold of someone. In the very middle of the pandemic, there were times when I was calling people back just so that they would have a voice on the other end of that phone. And that's not enough. It was enough in a crisis, but if they're getting a call, if they have a voice on the other end of that phone, it needs to be somebody who can help them and not just somebody who's trying to be, an understanding voice and a liaison. It also, we also created more accountability and a plan for the next emergency, because we were caught flat-footed, but we shouldn't have been caught flat-footed for 4 to 6 months, because as soon as we saw what was happening, we knew, we could have anticipated that on the other side of a shutdown was going to be massive unemployment. And we also expanded access to benefits, which is really important, because we're still playing catch up. We still don't know exactly what this whole unemployment looks like. We're still trying to figure out if people got the right amount, why they're getting clawbacks, why they're being told that they were overpaid, why they're being told that they're overpaid and then they got too much and they owe, and then they put in a claim and the overpayment is a mistake and they don't owe it. So all of that is things that we have to unpack. And so we now have a mechanism by which we can do that. We had a lot of healthcare bills this time too. And of course, I'm on health and government operations. And our big focus, I would say our two big focuses this legislative session in terms of what we did in my committee was telehealth and health equity. Because we learned a lot with telehealth, and telehealth is not new. Everybody thinks that telehealth was something that happened because of COVID. It expanded because of COVID, but it's been utilized for a long time, particularly in the behavioral health community. And something that we learned from the pandemic was, although telehealth was more challenging in somatic care, physical care, telehealth was extremely viable in the behavioral health world, particularly in the recovery community. And in fact, the utilization, unlike somatic care, where the utilization as things were opening up, the utilization dropped pretty significantly. The utilization for behavioral health services actually stayed relatively the same. And so I actually put in a bill that was then absorbed into our large telehealth bill, specific to behavioral health and reimbursements for behavioral health telehealth care, because the big telehealth bill that we have that was expanding and extending the emergency order for telehealth utilization, so that we could actually study what happened, what worked, what didn't, and make sure that our dollars are making sense. But I put in a bill that just focused specifically on behavioral health care and and we absorbed it into our large telehealth bill. But it made sure that that a few things happened. One, that the reimbursements were adequate and equal, because telehealth is just the delivery method by which we're delivering services, but the services are the same, whether they're in-person services or whether they're telehealth services. The services don't change. The standard of care does not change. So the reimbursements need to be, somewhat equal. But it also made sure that we could deliver telehealth not just through audiovisual and not just through synchronous, but asynchronous. So at the same time or not at the same time, but also that we could do audio only. And last year, when we were pivoting quickly, we were very reluctant to do audio only. We made it part of the emergency order because it made sense. But we were reluctant to do it because, again, even though we're just talking about a delivery method, it seemed like a lesser service. Well, what we found is in behavioral health, the preferred delivery method for telehealth was audio only. And it makes sense because a lot of people don't have access to technology. They don't necessarily understand the technology. Audio only, if you're talking about something very personal, means that you don't have to look at the person. They don't have to look at you. We also found that the audiovisual was very helpful for families that needed family services, because the provider was able to see the environment in which they were operating. It also allowed them to have immediate care without having burdens like childcare or transportation. So we really expanded upon telehealth, and we were able to sort of make sure that behavioral health piece stayed intact, even as we're looking at what's working and what isn't working with somatic care, because we already know that behavioral health care was working. So we want to make sure that we're keeping that piece fully intact. We did a lot with health equity. And in fact, we created a health equity commission because it was a little bit like Groundhog Day when we were looking at how COVID was impacting communities. And it was just over and over and over disproportionately impacting communities of color in terms of how hard hit they would be, or just gaps in access to testing, gaps in access to vaccination, and very real and historic hesitation about vaccinations. We have been working on this issue for a while, particularly around maternal mortality, because we have, again, we see a huge disproportionate rate of maternal mortality in communities of color. And also Maryland is on the higher end of maternal mortality, as well as on the higher end of cesareans versus VBACs. So we now have a commission that's going to be specifically looking at this issue and looking at legislation through an equity lens as it relates to healthcare. And we're also going to be conducting studies so that we can look at so that we can look at the data and look at the data from other states and how they have adopted policies that that bring greater equity in our healthcare system. I have a category that I put in here that's just called making things right. And we had a lot of those. As I said, this year, I was very proud of Maryland for really being a leader. I think we were a leader in telehealth. We were a leader in how we addressed our pandemic relief. We have been a leader in election laws. We're actually going in the opposite direction than a large part of the country who are trying to reduce voter access. We expanded it. I said, I don't know what more we could do other than put drop boxes in front of everybody's houses, because, well, essentially we've done that too, because that's your mailbox. And we were a leader in police reform and criminal justice reform. But when I talk about making things right, there were 3 bills specifically that I was talking about, aside from these other larger issues, and they were the HBCU funding, the Historically Black Colleges and Universities funding, which was in response to this long, extended, expensive lawsuit that Maryland lost. We were in the wrong, and we still weren't making our HBCUs whole. So we finally passed that bill this year. We also passed the Walter Lomax Act, which was a bill that actually Mr. Lomax came and testified last year on the bill, and in the middle of the testimony, he had a heart attack. He's still with us, but the stress of coming back year after year after year, he had a heart attack. And it is, again, it's about making wrongfully accused, wrongfully convicted people who spent, years, or in Mr. Lomax's case, decades in jail for a crime they did not commit, making them as whole as we are capable as a state. And we passed that bill this year. And we did one other thing that again, it's amazing that it took 2022, a COVID crisis, an economic crisis, the George Floyd, Black Lives Matter movement, but we finally repealed the Maryland state song. And it's not something that we did it very quietly, but it was a long time coming. And I think after the Capitol insurrection, that was sort of the final push. We said we can't have a state song that we're embarrassed to teach our school children. They only sing the first verse because we're embarrassed to have them sing a song that is celebrating, the Confederacy. We're embarrassed to have a state song that maligns Lincoln. And so we had a number of bills in around the repeal of the state song. Some were a repeal and replace, some were a repeal and here's a process by which we replace. But we took the most elegant solution, which is just repeal it and we'll figure it out later. And we didn't do it with a lot of pomp and circumstance. In fact, we did pass another bill. We passed in the House, which did not pass in the Senate, which was around making Juneteenth a state holiday, which would have provided state employees a paid holiday. And that was the piece that was controversial. It wasn't that we were trying to do it. It was that we wanted to do it and we wanted to pay for it. And Jocelyn Pena-Melnick, my vice chair, stood on the bill and talked about it. And she said, the reason that it was important is because where we put our money says, what our priorities are as a state, what we represent. And I think making history, sort of correcting our flaws in our history, and making sure that we're including everyone in our community in that history is who I think we want to be as a state. But that did not pass in the Senate, unfortunately. But it did pass in the House. I did touch briefly on election law. We did, we passed permanent absentee balloting. We expanded the number of drop boxes. We put some, we put some additional guardrails in place. We also expanded our voting in our Baltimore prisons, because often there are people who are being held, who are being detained, but they are eligible to vote, but they might not have a mechanism by which they can do it because of the timing. So we very proudly went in the opposite direction of large parts of the country. I don't know if you saw, we passed sports betting. There were some really big disappointments this year. We did not pass Climate Solutions Now. That bill that negotiation sort of fell apart in the final hours of the session. We were able to amend parts of it into other bills. We did get the expansion for trees. We got the Office of People's Counsel, but that was disappointing. We did not get eviction and renter protections. We had a large package that was heavily negotiated, heavily coordinated, and we were trying to find compromises, and it did not make it through. And we didn't pass the Child Marriage Act, which for those of you who have been following, I believe this was the 6th year or maybe the 7th year for the Child Marriage Act. And this year we were trying to pass basically two sides of it, because the concern in the past has been that there are young people who want to marry and raise a family and sort of do meet that mark, and what do we do for them? So we were passing emancipation for young people under the age of 18, so they could be emancipated, and then an emancipated minor could marry, and then raising the marriage age to 18. But it stalled in the Senate, and I honestly don't know what happened there, because it feels very common sense. I felt like the emancipation piece was really did address the concerns that had been raised year after year after year. The reason it's a problem is because young people who marry somebody who is an adult, it's often young women, 14, 15, 16, marrying a man who's 30s or 40s. They are still technically a minor in the eyes of the law. So they can't sign a contract. They can't go to a shelter. They can't even file for divorce without consent of their spouse. And essentially it's putting the spouse in the role of also being the parent, which is just a very uncomfortable scenario. So I assume that we will come back next year. That one was frustrating. That one was disappointing. I'm getting the signal. I have left the biggest topic to the end, because I assume there would be questions, but police reform and criminal justice reform. And this is where we really did meet the moment. Obviously, there was a national movement that has been building, but was really unleashed by the video of George Floyd, which we couldn't unsee. The nation saw it and they could not unsee it. And communities of color said, this is what we've been talking about. So there's been a lot of talk about what we did and didn't do. There was a lot of back and forth between the Senate and the House. The Senate passed a package of bills that were bipartisan. The House opted to create one large omnibus bill that was, I would say, was more aggressive. And but it was really essential. And when I talk about when I talk to folks, because they say, well, why did you support this? I said, because we need an even playing field, because it doesn't work when we have a system where the rules change depending on who you are, where you are, and who is in front of you. And so our goal with our police reform was multifold. It was to create a level playing field where everyone understands the rules. And it was to prioritize life over property. And during the debates on a number of these bills, and there were a number of them, you heard that a lot: life over property, life over property. Because people shouldn't be killed for property. Law enforcement shouldn't be put in the position of a 3 a.m. gunfight because we want to make sure that we have access to evidence. And so, we looked at we looked at a statewide benchmark for use of force, We repealed the law enforcement officers Bill of Rights. We addressed no-knock warrants. We limited the use of no-knock warrants very specifically. We require body-worn cameras for all jurisdictions by 2025. We also created funding mechanism for those body-worn cameras, because it requires not just the cameras, not just the equipment, but it requires a team of people to review those videos, and it also requires technology to store them. We had one bill that didn't get through, and it was disappointing to me, because it was an important bill for our county. In fact, some of the members of our crisis intervention team were trying to help with it, and it was to prohibit retaliation by law enforcement agencies for officers who seek mental health treatment. And this is a challenge. We often say, like, who are the caregivers for the caregivers? And when we are asking our law enforcement to be everything, we need to make sure that they have the services to deal with the trauma that they are also seeing, and that they're not being penalized or repudiated for seeking those services. So we will be bringing that bill back again. Can you discuss? I have a question. Sorry, I have a question in the chat, and I'm going to have to get back to you on that, because I don't have the specifics of that to discuss it. And I apologize. I have a question from Noel. Can you discuss the salary parity for staff in non-public special ed? And I don't want to provide the wrong information. So I will get back to you. Noel, if you're on this call, can you just put your email address in the chat? You can put it in a direct message so that I can get back to you. I just got flagged that we are coming up on time. I can't believe an hour goes by very, very quickly. But I did want to see if there were any other questions that I can address, because I do want to be mindful of your time. Obviously, there's a lot more legislation that we fielded this year. These are just some of the highlights. There's more highlights in my end of session letter, and there's even more highlights on my social media. But I don't see any questions. Oh, let's see. I'd like to know if more in mental health areas help families get their loved ones help. Yes, that's a great question. And Felicia, as you may know, my passion, my interest is in behavioral health, and after this bill that I had in was just one of a larger package of behavioral health bills. Of course, last year we also passed the crisis bed registry, which we're just starting to work on now, because that bill was vetoed and we overrode the veto. But I'm also working. I'm forming a task. Not a task force. Sorry, a work group around advanced directives for behavioral health services, and to see how we can expand the utilization of advanced directives for behavioral health services, because one of the biggest challenges, as I'm sure you're aware, is that providing help for family members, particularly adult family members, is extremely challenging, because the bench for crisis intervention is very, very high. And it's very high by design, because we don't want to be tromping over people's civil rights. However, there is no good mechanism for assisting people who have a family member who's not in crisis, who's not at that point of harm to self or other, which is the standard, but is still in jeopardy, which is, not dissimilar to why we had the mental health access initiative, because there are often adolescents that are in that's where they are. They're in that gap between crisis, I want to hurt myself, I want to hurt someone else, where you have to say the words and then age of consent doesn't apply, or, CPS, because not everything rises to the level of child protective services. Sometimes you just need someone to talk to, but you need it to be somebody who is licensed and trained to provide that help. So, so the short answer is yes, there's more coming. The longer answer is we are still trying to figure out what works. And part of this work group is going to be looking at what other states have done in this arena, because that advanced directive for behavioral health would be a mechanism by which we're not stepping on people's civil liberties. And when they are in sort of the good place between, when they're not in the darkness, they are able to provide a mechanism to their family members that they can then utilize when they are in that dark place, when they aren't in a place to make good decisions for their care. And so I will be working on that diligently throughout the interim, and hopefully I will have legislation coming up in the next session. And I would be happy to talk to you about that. I'm getting the signal because I'm going over. Thank you so much, everyone who is on this call. I really appreciate it. We have big challenges, and I am so very, very honored to be here representing you in this this historic moment in our in our lives, and in the midst of really fighting for the soul of our democracy. Sometimes it feels a little hyperbolic to say that, but I don't think it is. And so the little part that I'm able to play in that larger picture is truly an honor. I need to turn it over to.
All right, I'm going to turn it over to Luke for the wrap up. Thank you once again, everyone, for being on this call. I really appreciate it.
Thank you so much, everyone. I also want to thank the community leaders that have joined us this evening, and of course the representatives of our federal partners. Are super happy and thankful that you are doing all that you are doing as well, and thank you for that. Adam and Jaylon, and of course Mr. Smith, representing our comptroller. We should, of course, thank of the delegate of the evening, and that's Delegate Bagnall, of course, for everything that she's done. And we hope that you will continue to support her. And if that is something that you feel open and able to do, please do visit heatherbagnall.com to either subscribe to the newsletter, to volunteer your time and efforts going forward, or to make a contribution. That would be fabulous. Otherwise, thank you for a great meeting. Thank you for joining us this evening. Please stay safe. Please observe COVID protocols and stay healthy. And we will see you down the road. Good evening.